So now coming to the management. So there are certain pain cancer syndromes also, pain syndromes also, which once your doctor asks you certain questions, examines you, and maybe asks you to go through additional investigations or scans. With this, he is able to understand that what is exact cause and how to best manage this pain. Major role in the pain management is of the drugs or the medicines that we prescribe. Then we have different type of medicines, commonly such as we say them opioids, non-opioids, NSAIDs. These are different class of drugs which we use in the management of pain. And then there are adjunct drugs also, drugs that we additionally use, such as steroids, such as anti-epileptics, antipsychotics, and at times bisphosphonates. These are the drugs we frequently take help of. Now coming to the route, there are various route of administration, such as intravenous, intramuscular, oral, transdermal. So there are many other ways also, but I will talk about some frequently used. If you are hospitalized or if you are in the hospital, the most commonly used route is intravenous or the intramuscular. And once you are at home, out of the hospital, oral or the transdermal, which is through skin. I will discuss them in more details. Oral is, again oral, there are some tablets which are mouth dissolving. So this is important to know that there are drugs, because cancer patients are at times on many drugs, so the pill load is high. It is difficult to take so many tablets. So there are drugs which are available which are mouth dissolving. So once you keep them in your mouth, they will dissolve and they will act. And then the transdermal, they are like small patches. They are just like bandages which you can stick on your shoulder or back area which is not easily accessible, so that you do not scratch them out. They can be kept applied depending on the drug they contain for 24 hours, 72 hours, that is 3 days or 7 days. So the drug is slowly absorbed through the skin into your blood circulation, and it can act at a site remote also. It doesn't mean that if you have applied the patch on the shoulder or back, it will help in the pain which is around shoulder or back only. So it can help, it can work in a pain which is at remote place also. So these medications are used. Once you are in hospital, it is easy for doctors to titrate and give you appropriate dosages. And once you shift from the hospitalization towards home, the dosages may need to be changed and routes may also be need to change, because it's not every time possible to give intravenous, intramuscular drugs at home. Here again, the control of the pain control may go haywire, but I don't think it is need to worry, because once you will consult, we may have to do up titration. We have the drug conversion ratios. We know if a drug is given intravenous in a particular strength, then maybe the oral strength, what is the oral strength required for that particular dose. Your doctor knows this, he will help you to understand. And then we need to understand what is the duration of action of the drugs, because there are some drugs which are taken every 4 hourly, some drugs which are taken every 6 hourly, one drug which is taken every 8 hourly. It is very easy to control or manage pain if we take our medications regularly. Once many times patients say no, pain is relieved, so we may skip one of our dosages of the pain, which is actually not right or the correct way, because once pain is again started, it requires higher dosages to control it. So we commonly say the pain begets pain, which means it will require a higher dosage.